Hey, good morning. It's Monday. Just come out of my my oncology session. I've also just had my first Zoladex injection. So I've been on the Golex now for 2.5 years, but they've now changed to Zoladex, which will be every 3 months. So that'll be useful and much more helpful for me. Yeah, and that was only 10 minutes ago. I've had the injection, so it feels all right. However, a new twist in my story. My oncologist is now recommending that I start chemotherapy. I don't know how I feel about it. If you'd have asked me 2 years ago, I'd have been terrified, because the chemotherapy, I watched my father-in-law pass away through, he had cancer of the esophagus, which was awful, basically starved to death, and he was on chemo, and he had a lot of bad reactions to it, and it kind of scares me. But having been in the chemo world quite a lot and watched people and talked to people, I feel quite positive, and I'm trying to keep my mindset so that I'm thinking that the chemo is there to help me, not attack me, because I really wanted chemo to be my last resort, but my oncologist is convinced that my PSA is going to continue rising. I do have an aggressive form of this cancer, and she said it was only a matter of when, not if, it was going to happen. So strangely enough, I feel quite calm about it. Perhaps in another few days I might just suddenly burst out in tears and think, what's going on, you know, because chemo was for me the end. It's the last resort. However, she said that she thinks there is a little bit of cancer left. They're going to do the restaging scan, so all the scans are going to happen again. My last scan did show a little bit of cancer, but not a lot, but a little bit in my pelvis, and I think that they want to try and tackle that, and see what happens to the PSA, because she said the PSA is only a marker. So yeah, I need to really get my mindset right and keep positive about this, because I think this one is extremely easy to go to become very scared and very frightened and frustrated and all those negative emotions that are probably purely natural. I need to do the opposite. I absolutely need to do the opposite. I need to become a much more powerful mindset, where I'm just thinking about the positives of this chemo, 10 sessions, one every 3 weeks will be helping me, not hurting me, helping me, and go with that, because I don't know how else to do it. And I've heard about all the side effects that are going to come along with it, or possibly, and again, I'm going to use the power of the mind over the body to try and dampen those down, because I guess really in the last 2.5 years I've been really lucky to not get some of the severe side effects that people do have on the hormone therapy. I'm going to continue that. Hopefully this new injection, this Zoladex, won't change things and make me feel any worse than I normally do after an injection. Yeah, the main thing is positivity, a mindset where I have to believe I can beat this. That chemotherapy is just another part of the adventure, and we'll go with you know, whatever they recommend. At the end of the day, I'm not the expert, they're the experts, and I have to trust in their judgment. But I'm going to do other things as well to ensure that I'm going to give myself the best chance as well. I'm going to try from now on, no matter how shit I feel, I'm going to get out and do some exercise, and I'm going to turn this around. I'm going to turn this around. And we'll just see how it happens, shall we? I've got to go to work now. So until the next time, that's an update. I want to be positive, and I think I've made it positive. You know, bring it on, chemo. I'm going to beat you. Speak to you next time. Bye.